The slowing pace of coronavirus vaccinations is forcing U.S. officials to get creative in their outreach. Less than 40% of the population is fully vaccinated. Nearly 50% has received at least one dose. We'll have more on those efforts in a moment. But first, more states are opening up for the summer, and confusion over when and where to use face masks is growing. Omar Villafranca reports.
You are violating my rights.
Confusion, chaos, and conflict. A nationwide battle over masks. Tonight, cities and counties in the Lone Star State are dropping mask mandates or risk facing a $1,000 fine. This comes more than a week after the CDC loosened its mask guidelines for fully vaccinated people.
Somehow that got interpreted as saying, well, masks, forget masks. We don't need to wear masks, which is not the case.
But still, there's mask confusion. At school board meetings around the country, tensions are high as parents demand mask policies be removed at schools.
Stop trying to incite division among us.
But a new CDC report found COVID-19 infections were 37% lower in schools that required teachers and staff members to use masks. A new warning from the FDA after reports of some Chinese-made needles used for the COVID vaccine were detaching from the syringe after injection. Today, the University of Virginia and Indiana University joined more than 400 other colleges and universities mandating that students be vaccinated. Meanwhile, a continuing push to get more Americans vaccinated, especially young people. Incentives including cash, lottery prizes, and season tickets to LA Laker games. The White House is even teaming up with popular dating apps, encouraging those looking for love to get vaccinated. App profiles will include badges showing a person's vaccination status. One of the few places you do have to wear a mask, at the airport and at federal buildings. In Texas, business owners can decide if their customers wear a mask or not. Lana?
All right, Omar, thank you. For more on all of this, let's bring in Dr. Taison Bell. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, thanks for being here. Thanks for all that you do. You know, I'm remembering when we had you on, when we were celebrating the pace of vaccinations ramping up in the United States. And now we see that this pace has slowed by nearly 50% since just last month. How concerned are you that this could impact the nation's recovery as we are looking so forward to everybody becoming open again for summer?
Sure, good question. And it's certainly something that is concerning, but we did know that this day would happen. The days of the mass vaccination part of this campaign are over, and now is the part where we have to get the vaccine into local communities and get the people that are still on the fence, because we mostly vaccinated those who have been eager and those who have had access. And what's particularly concerning is that this average reflects a lot of variation. So some states, it may be slowing down because a large percentage of their population is already vaccinated. In other areas, particularly in the Southeast and southern states, it more reflects vaccine hesitancy and ongoing hesitation with getting vaccinated. And so these areas we have to particularly target to make sure that we have easy access, education, and incentives to make sure that people who are on the fence go ahead and get vaccinated.
And even as we're talking about trying to get people still their first or second doses of the vaccine, Dr. Anthony Fauci was talking about a booster shot. He says it's unclear when we may need one. What factors will ultimately determine this, Dr. Bell?
Well, a couple of factors. So we know that with the coronavirus vaccine and with COVID-19 infection, your antibody levels initially go up, but they do wane over time. Now, for the average person, it's still unclear how long that protection will last. It looks like studies have shown that up to 6 or even 8 months out, it looks pretty good. But how long that lasts, still yet remains to be seen. Then, of course, the other wild card here are the variants. And so with a lot of this at play, it does make sense to go ahead and prepare for that possibility and talk about it more like the CDC and Dr. Fauci are doing. And then we see reports like Pfizer and Moderna are already preparing for that possibility. But if we'll need it and when, it's still a little unclear at this point.
Mm-hmm. The CDC is recommending that schools prioritize universal mask use regardless of vaccination status. But as we just saw, there's still pushback from some parents and even some states that have been prohibiting mask mandates in school. I was so struck by Omar's reporting 37% lower COVID rates in schools that do have these mask mandates. I'm wondering, what are your thoughts and how would you advise schools as they are trying to decide on what they should allow or make standard practice as they head back to in-person learning?
Well, this has certainly become a polarizing issue. And as we've seen over the course of the year, generally schools have been safe, but a lot of that has been attributed to layered protection strategies. And what that means are universal masking, social distancing, hand washing, and cleaning facilities. Now, of course, vaccination does change that a little bit. But of course, if you want to make sure that you have the safest environment possible, especially if we're going to go into the fall year with children under 12 years old not vaccinated, it does make sense to have universal masking still in place. And so the CDC is working on updating their school guidance. You could probably anticipate that children 12 or under will still be advised to, in those classrooms, to still universal mask. As for 12 and above, it's a little unclear. I think the important thing to remember is that along with these layered protection strategies, you have to have flexibility. So it has to reflect what's going on in your local community. So if cases are going up, hospitalizations are going up, or if there's low vaccine uptake, these are situations where especially you want to have universal masking for all grades.
And as you mentioned, that there might not be a vaccine for younger children until the fall. I'm wondering, do you think that parents should be concerned about younger kids' ability to safely participate in summer activities? And how would you advise parents who are concerned?
We've seen that the chance of infection is generally lower when outdoors. And we also know that children have been cooped up for over a year now. This has been a tough year, and being outside and in fresh air is very good for your mental well-being. And so outdoor activities for children are certainly one of the safer activities to do. I think when it comes to especially younger children being in tight enclosed spaces with lots of people, it makes sense to go ahead with CDC guidance and put a mask on in those scenarios. I think that we can have a good, productive summer and have lots of fun, but still remember that we haven't quite turned a corner on this, and we still have a ways to go. Another piece of encouraging data is that studies have shown that children are safer and protected from getting infected if the adults around them are vaccinated. So another great way to protect our children is to make sure that the adults that they interact with are also vaccinated.
An excellent point. All right, Dr. Taison Bell, thank you.
Thank you.